a survivor. Yeah, through the strength of my culture.
Welcome back to the Now Morning Show. Now, recently, there was some comments made before a Joint Select Committee of the Parliament on Social Services and Public Administration. These comments were made by Dr. Asante LeBlanc, the head of the Trinidad and Tobago Cancer Society, which she later on went on to apologize for these statements, but they were based on the availability of cancer treatment, drugs, and patient care. This morning, the Honorable Terrance Deyalsingh, Minister of Health, joins us online to clarify some things about the availability of cancer treatment, drugs, and patient care. Good morning to you, Minister.
Good morning, Rawkus. Good morning.
How are you doing this morning?
I can't complain, my brother. All is well with me.
Lovely to hear that. Now, can you give us an update as it regards to availability of cancer treatment drugs in Trinidad and Tobago at this time?
So let me say categorically, there is no shortage of cancer drugs in Trinidad and Tobago. And I was very disappointed with Dr. LeBlanc's statement for many reasons. One, she sits on the Drug Advisory Committee of the Ministry of Health and will know how drugs are approved and will have some idea of drug availability. She sits on that committee chaired by the Chief Medical Officer. So to make the statement that drugs are antiquated, if they're available or none at all, is, I want to be diplomatic this morning, is simply not true. Her statements have caused a lot of turmoil in the health sector and within the field of oncology. And I noticed the Express editorial this morning saying that she has nothing to apologize for. Well, I take issue with that.
Well, Minister, let me interject here, because there's also a Guardian article where she has apologized as well. She did say in a Guardian article that she's apologizing for any inconvenience caused because the statements were incomplete. She admitted that much.
Yes, but apparently the Express editorial, which was written last night, came out this morning. They didn't get that memo.
Right.
That she spoke from a point of incomplete information.
Yeah.
And then she said, strangely, she then spoke to oncologists. So she didn't speak to them before. She spoke to them after, which is rather strange. But one oncologist WhatsApped me last night and said, and I quote, I don't want to call the person's name, every drug in Trinidad and Tobago is on the 2024 NCCN guideline. What is NCCN? National Comprehensive Cancer Network Guideline, and also WHO Essential List, or both. And this oncologist ended by saying, none of these drugs are obsolete. So how could the Cancer Society, which has a rich history of 50 years in this country, with the power that they have representing the interests of cancer, and they have done phenomenal work for 50 years. And I congratulate the society and Dr. George Lakis, who started that society. When you have that type of heritage to protect, it is incomprehensible that these statements could be made. And then after you make it, which the Express didn't get, you now went and you spoke to oncologists. One of the drugs that the Northwest Regional Health Authority put out, cisplatin, which is not available in the United States, which is available here free of charge. Let me quote you something. Today's critical shortage of cisplatin and carboplatin occurred because manufacturers failed to invest in enhancing production capacity. Richard Pasdor, Director of the FDA Oncology Center of Excellence and Acting Director of Office of Oncology Diseases, said to the Cancer Letter. We always say, why can't we be like the United States? Well, this is the United States. You can't get cisplatin in the United States for two reasons. One, if you don't have insurance. So no poor person with limited means can access cisplatin. And now they don't have it. But we have it in Trinidad and Tobago. And we have worked too hard for 8 years to do our very best to have this type of expose, which is not based on fact, which is now based after the fact, talking to oncologists, and you apologize. So let me say that Dr. LeBlanc's statements about shortages, antiquated drugs, and lack of funding is absolutely untrue. Because how could there be lack of funding where in the Northwest Regional Health Authority they spent $247 million on drugs, treating 180,000 patients, writing 208,000 prescriptions. And that's just Northwest, where the St. James, where the Cancer Center of Trinidad and Tobago is based.
Yeah.
So it is very disturbing. And I take issue not only with Dr. LeBlanc, but also with the Express editorial this morning, which is supporting unfounded allegations based on not talking to oncologists, which the Express didn't see. But now you are talking to oncologists and put out a press release late last night saying that you are now speaking to oncologists and your information was incomplete.
All right. Mr. Deyalsingh, let me jump to ask about the wait time, because one of the things mentioned as well by Dr. LeBlanc was the wait time to be able to get certain treatments. What, any comments on that aspect of things?
Rawkus, we operate a free public health system. Could you tell me any system in the world that you don't have to wait? That you could just walk into a cancer center? I mean, let's be realistic. Wait times are around the world. But people will have you believe that everywhere else is utopia. You walk into a cancer center today and you get treatment within an hour. It does not work like that anywhere in the world. And the United States, if you don't have insurance, you will wait until you die. A poor person. So let's work on our issues, but when you make statements of a condemnatory issue, research those statements first, and don't pretend that Trinidad and Tobago is utopia. Wait times happen everywhere in any free public healthcare system around the world.
Understood. And Minister, let me thank you so much for joining us and for sharing these comments and for clearing the air and making sure that we all understand what exactly is happening and the correct information is being shared as well.
Could I just make one last point?
Definitely.
A cancer diagnosis is not easy. It's bad enough. But when the Cancer Society tarnishes the reputation of the public health sector, when a new cancer diagnosis, if you are diagnosed today, Rawkus, how do you feel coming into a system that has been so bad-talked by Dr. LeBlanc, putting on top of your pain, your family's pain, that you are a cancer patient?
Yeah.
My God, is this what the Cancer Society has come to? We provide care from diagnosis to treatment to palliative care. And you are telling cancer patients falsely that, look, when you go to the public health system, you're not getting any drugs and they are antiquated. That is simply wrong. And it's not seeking the interests that the Cancer Society is supposed to be seeking for citizens of Trinidad and Tobago. Do your research. Speak to oncologists first before you speak, not after. That's my point.
Definitely. Well, thank you so much for clearing the air there, Minister, and for making sure that we understand exactly what's going on.
You're welcome. Thank you.
Take care. Enjoy the rest of your day. Ladies and gentlemen, the Minister of Health, the Honorable Terrance Deyalsingh, just clearing the air as it pertains to the availability of cancer treatment, drugs, and patient care right here in Trinidad and Tobago. We take a quick break, and when we come back, we're going to talk a little bit about more health. We have a health fair coming up. Stay tuned.